What is standard procedure for recall notification by a manufacturer when a medical device is being recalled?
Medical device. Well, when there's a determination that the device is out of compliance, whether it's through an FDA inspection or through consumer complaints, medical device complaints, through user facilities, healthcare providers, whatever, they will start the recall strategy to bring the device back or get out there and correct it. The manufacturer will do that. They will also, at the same time, do a parallel notification with the Food and Drug Administration so we can get involved. We sometimes will help them with formulating their recall strategy. If it's a Category 1 recall with threats of death or extremely serious injury, we take all recalls very seriously. Category 1 is extremely serious because of the death threat or the serious injury threat. We will help them if they need it with their recall strategy, a press release or notification through legitimate means of communication to the manufacturer's vendors, through healthcare providers, to users of the product is expected and done. They do that. We will do audits during the procedure, and we will monitor how they are doing on the recall itself. So it's a parallel verification process and such. If you look at the recall process, it comes down from the manufacturer to the wholesalers, as I said, to the healthcare providers, and the patients, being the users, need to know and are informed, or supposed to be informed, by the doctor who did the work, the hospital, user care facility.
But is that always happening?
We'd like to think it is. We audit very closely, and we found that these industries are extremely sophisticated, as I mentioned earlier, and extremely responsible. In some cases, if they are slower in the uptake as far as notification goes, we step in and help them do the right thing. So we find, by and large, yes, people hear about it, and the process evolves and works pretty well. It's serious business, Susan, very serious business. We take it seriously. Regulated industry takes it seriously, and we make sure that we have the enforcement in place to make sure that it's carried out. We've been doing this for a long time.
Mm-hmm. Ultimately, is it up to the manufacturer to make sure that each and every patient has been notified?
It is. The primary responsibility falls on the manufacturer. They're the producer of the device in question. They provide the serial number, the lot numbers, the proper name of the device, what is wrong with the device, the impact that it has. They will even work and talk with physicians if it's an implanted device to see if it has to be explanted. Very sensitive sometimes. Extremely stressful environment when you're talking about an implanted medical device. So we expect them to do the right thing and do the proper notification. We will do the audit checks depending on the level of the recall, Category 1, 2, or 3. And we expect them to do the right thing.